An overview of psychological conditions.
Now, this is the course on pastoral counseling. Even so, a pastor cannot avoid meeting people who are in need of other kinds of counseling. Now, this can be unfortunate both for the pastor and for the parishioner if the pastor decides that he is going to try to play psychologist. Nevertheless, you need to know them so that you can have a general recognition of what they are.
Now, there are four classifications of psychological disorders: mood disorders, thought disorders, personality disorders, and behavioral disorders. Let's talk about mood disorders first. There are three basic classifications of mood disorders. There's depression, again, that's the most common, anxiety, which is almost as common, and then there's bipolar or manic depressive, which is really a form of depression. The symptoms of depression are as follows. There's a general feeling of sadness, an inability to enjoy life, which is also called anhedonia, a lack of energy, a sense of hopelessness, and fatigue. Now, everybody gets depressed. In fact, it's been called the head cold of mental illness. However, when is it important to get treatment for depression? When is depression clinical? When there is no obvious cause for it. When it lasts more than a few days. When it interferes with work or relationships. When there are suicidal thoughts or actions. And when there are psychotic or thought symptoms such as hallucinations or strange thoughts. The causes of depression include spiritual causes. Sometimes depression can be caused by sin in one's life or by demonic attack. There are also physical causes for depression, though, as well, such as sickness or the reaction to various kinds of medicines or just plain fatigue. There are also psychological times that we get depressed. When we're under stress at work, for example, or when something happens that is a reversal to us, it can cause depression, as well as grief or trauma. It is normal to feel sad when you lose somebody you love, or to feel weak when you've actually gone through some great trauma in your life. These are all normal causes of depression. Anxiety disorders are somewhat different, though related. One of the main symptoms of anxiety disorders is our unreasonable fears, where we may have a general sense of fear or unease or worry, nervousness and worry about things that should not worry us is an example of an anxiety disorder. Panic attacks, that's where we suddenly feel very, very panicky. Many of these panic attacks and symptoms may mirror physical illnesses. We may think we're having a heart attack, or we may think that we're having a stroke or some other issue like that. It just suddenly comes upon us as a great sense of dread or even a physical illness. Depression and anxiety often go together. It's very common to be both anxious and depressed. The causes of anxiety are many. It is similar to depression, and then it can be spiritual, psychological, or physical. It's commonly the result of physical or psychological fatigue. We just wear ourselves out, and then we go through a breakdown. This is both psychological and chemical. Oftentimes, people inherit from their parents through their genes a tendency to be anxious about things. There are many kinds of anxiety. There's what's called generalized anxiety disorder, where you just have that general sense of being worried. There are phobias, where a person may be afraid of things that make no sense, such as cats or people with long noses or open spaces. A person can go through what's called a breakdown, where suddenly they cease to function properly and are overwhelmed with a sense of anxiety or dread, or just are unable to make decisions. Panic attacks come upon us, can be a sense of anxiety, and they can be so close to physical ailments that we truly believe that we have a physical problem. Anxiety disorders are treated by medication, by talking it out, and simply by getting some rest. Oftentimes we find that if we get a good night's sleep or a few days of vacation, the symptoms of anxiety go away by themselves. And if we don't, it might be time to mention it to a doctor. One kind of mood disorder is bipolar disorder, which is quite commonly spoken of as manic depressive disorder. The symptoms of a bipolar disorder are severe mood swings, where a person may go from being very elated and full of energy to absolutely no energy in a very short period of time. Mood swings, typical of bipolar disorder, last days or weeks, not hours, as some people think, but days or weeks. And they're often accompanied by psychotic symptoms. Especially during the manic phase, we find that people are often led to have strange thoughts. The causes of bipolar are believed to be almost always physical causes. This is not caused by stress, it's not caused by upbringing, but it's caused by something chemical in the brain. Usually it is not helped by counseling alone, and it requires medication. The second general classification of mental illness is thought disorders or psychosis. The two main kinds of thought disorders, schizophrenia and temporary psychotic episode. Actually, the definition of schizophrenia is that it's a permanent psychotic episode. Thought, such as schizophrenia, means that you have chronic psychotic episodes, times when the brain behaves strangely. This may be accompanied by hallucinations, either things you see, things you smell, things you hear, words in your brain that are not there. It may or may not have hallucinations, however. Affect disturbances is another characteristic of schizophrenics. That is, they may look sad when they're actually happy, or be laughing when they're sad. They make strange mental connections. They may think the man on the television has power to change their life. They may think that the FBI is tapping their phone, or that trees are trying to control them. These make no sense, but they do to a schizophrenic. Paranoia is quite common. They think that people are after them. The onset of schizophrenia usually happens in a person's teens or early 20s, although there are examples of schizophrenics who came on very early, even in childhood. Most of the time it appears in the teens and 20s. The causes of schizophrenia are considered to be almost always physical causes. Something goes wrong with the wiring of the brain. It is believed that an excess of dopamine may be the cause of schizophrenia in most cases. That's a chemical in the brain. The treatment of schizophrenia, medication, is almost always prescribed. Have wonders now in antipsychotic medications that have given many schizophrenics back their life. They can, however, be helped by supportive therapy, though therapy and counseling will not cure schizophrenia. Psychotic breaks are temporary schizophrenic symptoms that are quite common and happen. They're not permanent. They quite commonly happen at the onset of stress or grief in many people. It's quite common for people who've lost a husband or wife to show psychotic symptoms, for example. The treatment is medication, care, and support. The third kind of general group of psychiatric disorders or psychological disorders are personality disorders. Now, these are not mood disorders, they're not thought disorders, but they are the entire personality, a dysfunction of the overall personality. It is not what they think or how they feel at any moment, but it's actually how they live their lives. It is the least treatable of all disorders from a psychological perspective because it affects the whole body, the whole psyche. There are many kinds of classified personality disorders. They include paranoid personality disorders, oppositional, that means that they're defiant, schizoid personality disorders, these are people who just simply disconnect with the rest of life, narcissism, people who are totally and utterly selfish, Psychopathic or sociopathic personality disorders are people who do not feel what other people around them feel and could care less for how other people feel. And borderline personality disorders, where you may have rapid swings in opinions and thoughts and reactions. These can cause havoc in a church situation. And compulsive lying, or what is sometimes called Munchausen syndrome, the creation of symptoms and lying about things to get attention. The treatment for borderline disorder, unfortunately, there are few effective treatments for personality disorders because people who have them often do not recognize that they have them, and so it's very hard to treat them. They may be reformed, however, by the Holy Spirit. We must always believe that prayer can affect all illnesses, including ones of the personality. The fourth is behavioral disorders. The fourth, behavior disorders, which include obsessive compulsive disorders and addictive disorders. Obsessive compulsive disorders include uncontrolled habitual thoughts or actions, ritualistic behavior, such as washing your hands constantly, uncontrollable obsessions, hoarding, and obsessive cleanliness. Addictive behaviors include drinking, gambling, sex, shopping, codependency. Cults can be an addictive behavior as well. The causes of addiction: it may involve the ingesting of addictive substances that are physically addicted, such as drugs, medicine, or cigarettes. It usually involves a personality that is prone to be addictive. And it always has a spiritual component. So pastors and other pastoral counselors are very important in helping people with addictive disorders, though they cannot do it often without other medical sources. The spiritual component is very, very important. Addictions are really a form of idolatry.
Now, whenever you meet one of these conditions, you should refer them to a licensed counselor who is able to deal with them. This does not mean, however, as a pastor, that they don't need pastoral care. We are called to visit the sick, whether they're emotionally sick, spiritually sick, or physically sick. The families of people with mental illness very much need our help and advice. One of the great tragedies of mental illness is that people become afraid of the word mental illness. And that goes for pastors as well. We cannot let that happen. We must help whenever we can and be a healer for those people who need it so desperately.